Hi, I'm Dr. John Acosta, President for the Mateo County Dental Society. We wanted to try something different this year, and actually I wanted to introduce to you and interview our speaker coming up on Thursday, January 18th. And his topic's going to be on robotics and dentistry, the forefront in technology. I'd like to welcome Dr. Nima Massoomi.
Thank you, John.
Is that the right way to pronounce it?
Yeah, you got it. It looks a lot more complicated than that. That's correct.
The beginning of the year is a great time for us to be able to check out what's new, and this is a great topic. And so we actually, I feel like we now look to the future with you as our speaker. First of all, congratulations, you're expecting your baby really soon. That's a big deal. Let's get a little background on you.
Robotics is just honestly an off-chance thing. I mean, again, I was an engineer before I went into healthcare and other things. So I've always been one of those guys that tinkers with things and takes things apart even since I was a little kid. And then it just happened that when I was in San Francisco, one of my patients introduced me to this company out in Florida, and it just took off from there. So for the past almost 5 years now, I've been developing this robot with this team of engineers in Florida, and it's one of the first approved FDA-approved robots in the country for dental surgery types of things.
That's great. Now, I read in an article there's only 3 of these robots?
Yeah, right now there's only 3 because, they have to, in the beginning it's very strict in regards to how they put these out because they need to make sure they control everything and quality control and other stuff. So I think I'll be the first one actually on the West Coast to have that robot start doing surgeries, and it's going to be actually in a couple of weeks. They have to literally manufacture it, so that's what they're manufacturing right now. And then they have to drive it across. I mean, they can't, it's not the type of thing you just ship it to UPS. They have to literally drive it across country. The thing is like almost over 500 pounds.
Wow.
Yeah.
And where are you going to put the robot? Or is it going to
The robot right now, it looks like it's going to go to Cupertino since that's the oldest practice, it's the most established one in terms of patient volume and other things. And then also we look at the patient demographics and stuff. But I also have a second one that's coming probably next year at some point, and I'll put it probably in San Francisco.
Thank you again for saying yes and coming to our dental society. Our membership is really excited to hear what's at the forefront. Can you give us a little preview of what we'll expect next Thursday?
Honestly, I'm just going to kind of take, I guess, the whole society through like what my experience has been since I've started practicing about 10, 11 years now, and how my practice has changed with technology and how we're doing dental implants. I mean, I'm doing things now that I would have never done 5 or 10 years ago. And the advantage of being in Silicon Valley is that we got so many great companies here at the forefront of advancing healthcare, innovations and other stuff that we get exposed to these things. So I think one of the biggest changes for me was to go completely almost guided for almost everything that I do, whether it's implant surgery, jaw surgeries and other things. I'm really using CT guided technology to kind of drive, better results and better outcomes. And then we're looking at things on the back end, double checking things. So like, I'm at faculty at UOP and we're doing a bunch of research studies. We published 2 papers last year looking at the accuracies of surgical guides and, genioplasties and other things using 3D printed modeling and stuff. So, everything's changing. I mean, I can't imagine what's going to be like 10, 15 years from now. It's just going to be completely different. So I'm just going to take people through like what my progression has been. How did I start off with, and how I kind of took one step, and then from there took it on to another step, and then finally get into the robotics side of things. Yeah.
Now, there's a lot of dentists or oral surgeons out there, obviously, that are using guided surgery, general dentists out there that are using that. How can robotics improve on guided surgery? Guided surgery almost seems exact.
And it completely bypasses surgical guides. So the whole advantage, our goal for bringing the robot on is to make sure that you can almost do same-day surgery. Because the biggest challenge right now, where the lag that we have is you got to, patient comes in, you take a CT scan, you work it up, then you got to send it off to get the surgical guide made. What the robot does is that it completely eliminates the need for the surgical guide. It literally will put the implant where you want it to based off the CT scan. So everything is all controlled. So I'll have some videos that shows how the whole robot works. But so literally what can happen is that you have a patient that maybe tripped and fell in the morning and then literally gets sent to your office that same day. You should be able to do the implant. And also my goal is to get to a point where we can actually go ahead and either 3D print or even mill a temporary crown or something the same day on that same patient, but everything would be guided from start to finish. Yeah, so that's the thing that I think is going to change things, is that you now don't have to worry about surgical guides anymore. Yeah. What's coming in the horizon guys, and it's just unbelievable. We're actually doing a research study right now where we're actually having people put in surgical guides freehand, and then, but beforehand, do a treatment plan, and then get a post-op CT scan. Did the implant really end up where you wanted it to go? And so no one's really looked at that. So we know based on our early data is that our accuracies are under 0.5 millimeters. Yeah. So if we can do things with that accuracy, then it opens up a whole set of other things that we can do, from prefabricating everything. Right. So if you're that accurate.
Do you see other applications for this besides in the dental profession?
Oh my gosh! Honestly, like I'm more excited about what this robot is going to do. I mean, I can't honestly. I'm not open to tell you all the things that we're planning to do with this robot, but it can be used for almost anything in the head and neck area because of the accuracies. So the dental implants is the first thing that's going to come out in the market, but then after that, it's basically endless. We can do a lot of stuff with it.
Exciting.
Being a specialist, I see, honestly, on a weekly basis, number of problems with implants not placed correctly, right? And we try to teach our students like restoratively driven implant placement. And so sometimes, when we try to correct things, I wish, God, man, I wish like this person that put this implant in had the robot, then we wouldn't be here and taking the implant out, right? So I think overall it's better for the patient, it's better for the dentist, it's better for everybody. I mean, I would love to put the robot in the hand of almost everybody that's out there, because it would decrease all the failures that we have, all the reuse that we have. That's what we're hoping. Yeah.
That's awesome.
You don't seem like the type that's accepting of status quo and keeping still. Once you get this robot into your office, I mean, what's next for you?
I mean, I'm getting pulled in so many directions, but the dean of my dental school, God bless him, Dr. Fonseca, he's one of the famous oral surgeons, and he's like, if you ever want to get anything done, you give it to a busy person. He's like, they'll figure out a way to do it. And I've always been a busy man. I'm always doing different things. I can't sit still. So we'll see what happens. Yeah, I'm open to a lot of stuff.
That's great. Well, you hear it first from our interview with Dr. Nima. Thank you for coming out and meeting up. And you're such a busy person, taking the time to come meet up and also coming and speaking to our society next week. We're very excited for it. I think this is going to be an incredible year for you, 2018.
Yeah.
2 babies, your actual first child.
Yeah, and then also a robotic child.
And your robotic child also.
I never thought about that. That's a good one.
All right. Well, thank you so much.
Thanks, John. Thank you very much.
All right. Yeah.